The nurse will see you now. A new survey finds the role of nurses and administrative staff is growing. And joining us this morning to discuss the changing future of healthcare is Executive Dean Doris Savron with the University of Phoenix College of Health Professions. Good morning. How are you today?
Good morning. I'm doing well. It's great to be here.
Well, I'm really excited to talk with you because this is a changing field as it is. And now if you specifically look at the professions, each profession is evolving as well. Is that correct?
Absolutely. We're at a tipping point for healthcare. Significant changes are happening. We also have medical advances that are helping people live longer. We have a baby boomer generation that's starting to use services more frequently, and we have more insured people using health services. That's putting a strain on healthcare systems who already have tight budgets and sometimes face workforce shortages. And so in our study, we had found that 80% of nurses and healthcare administrators are finding their roles expanding. They're actually taking on more and more responsibility for direct patient care. And in that survey, they'd indicated because of that, that they feel they need more training and development to be better prepared to continue to provide quality care.
So what do you think this means for the patients with all of these changes?
Well, the study had indicated that without that preparation, that nursing professionals are concerned that quality of care won't be maintained. And so for patients, they want to make sure as they're going into medical offices and having conversations, whether they're getting treated in a medical office or a hospital system, to ask questions, understand what's happening, find out why they're getting the treatment they're getting, see if there's alternatives, understand possibly the side effects, but be a player in their healthcare plan. But as long as healthcare systems are providing the training, then nurses feel confident, and when they're confident, they make good decisions, and good decisions lead to quality care.
I'm glad you brought up that training. How can these healthcare professionals be better prepared for their changing and increasing role?
So 90% of the nurses and healthcare professionals had indicated they want more leadership development. So that's a big one. 68% indicated they wanted more technology skills. We know that patient records are becoming electronic. That information is being shared across systems. They need to be able to be savvy to access the information they need to make better decisions and, frankly, create better care plans.
And when you're talking about healthcare plans, sometimes the information can just be information overload. So do you have a way that patients can kind of ask questions and better prepare themselves for these changes?
Well, the best questions is always to ask when they're in the office with the nursing staff and some of the other healthcare support staff. And if they still don't understand, to continue to ask the question. They're there to advocate for the patient and to support them. And so as long as they continue to ask those questions, they'll get the information that they need. And obviously, they could also go get more information on our website, phoenix.edu, on the study results, which will give them additional details.
I'm really glad you brought up that website because I was going to actually ask that next. So thank you so much, Doris, for the info. We really do appreciate it.